All right, now we're going to look at the homeostatic imbalances of the adrenal medulla, right? Where is the adrenal medulla located? So you have your adrenal gland, right? Adrenal gland, the outside is called the cortex, the inside is called the medulla. What was the function of the adrenal gland, specifically the adrenal medulla? It's the production of these catecholamines, norepinephrine, epinephrine, right? And so in the medulla, there are these cells called medullary chromaffin cells. And these chromaffin cells are responsible for the production of epinephrine and norepinephrine, right, in the body. So about 80% epinephrine, the remaining 20% is about norepinephrine, right? And so we talked about what the function of these is, right? So it's vasoconstriction of certain areas, increased blood pressure, increased blood sugar, right, through the glucagon pathway, right? So glucagon becomes active and it causes the release of these sugars from the glycogen storages presented in the liver, right? And also another big, really important thing is majority of the blood is diverted specifically to the brain, to the heart, and to the skeletal muscle, right? And so what's important about these is when you have a hypersecretion or a hyposecretion, we look at homeostatic imbalances, right? So we talked about hypersecretion, right? So what does hypersecretion mean? So hypersecretion means too much of this hormone, right? Specifically the norepinephrine and epinephrine, right? And so these patients, a perfect example of this is called Pheochromocytoma. Pheochromocytoma, right? So this condition, well, let me finish this, is when there is an abnormal tumor present in the adrenal medulla, right? So it pushes pressure on these chromaffin cells to begin production of epinephrine and norepinephrine, right? And so what would you notice about patients with this condition, the pheochromocytoma, right? These patients would exhibit high sympathetic activity, right? So increase blood pressure, increase heart rate, you have increased glucose levels, so sugar goes up, so you have an increased metabolic rate also, so you have metabolic rate. What else could happen? Hypertension, nervousness, behavioral changes, sweating, right? So these are all instances of excessive secretion of these catecholamines due to a tumor that is present in the adrenal medulla, right? Vice versa, we can look at hyposecretion. So hyposecretion is when your body makes too little, or if not, nothing, right? And so this can also be due to some kind of medullary tumor that can block the actual production of it, some kind of autoimmune disease that destroys the adrenal medulla. But the unique thing about this condition is this is not problematic. So this is not something to really worry about. And when I say not problematic, I'm saying it's not life-threatening, right? Patients may exhibit certain abnormalities in life, right? But these catecholamines aren't necessarily essential, or not necessarily essential, that's the wrong word, vital for the existence of life, right? So if these patients don't create epinephrine or epinephrine, they may have some kind of delayed sympathetic or parasympathetic response. However, that slow response will not cause any kind of danger to the person's health.